Healthcare is at the very top of President Obama's agenda, and now House Democrats are proposing that the wealthiest Americans shoulder most of the cost to reform health care. They're calling for additional taxes on households that earn at least $350,000 a year. If this plan, as it stands, is approved, House Democrats say 97% of Americans would have health insurance by 2019. So if we break this down, the current House Democrat plan calls for a 5.4% surtax on couples earning more than $1 million a year. Those making at least $500,000 would pay 1.5% more in tax, and there would be a 1% tax on households making at least $350,000. So the surtax would also apply to capital gains and to dividends. Still, even if the bill passes the House, of course, it may face problems in the Senate. But here to discuss the legislation as it stands more, along with the rest of the health care debate, we are joined by the number 3 House Democrat and the person who has the tough job of making sure all House Democrats vote along with the leadership, Majority Whip James Clyburn from South Carolina. Good morning to you, Congressman. Thanks for joining us.
Good morning. Good morning. Thank you for having me.
All right. Healthcare, obviously, very much a concern, very much in the crosshairs here, but particularly for the audience and the investor audience out there watching Bloomberg News, this idea of adding another tax to the highest income bracket is really stealing the show here. The top 1% of income earners in this country already pay 40% of the taxes. Congressman, how do you justify asking them to pay even more?
Well, for the last 10 years, I think all of us are aware that this is the group that benefited disproportionately from the tax cuts of the last 10 years. And so that's one way of justifying it. Another way would be this. These are the people who own the businesses. These are the people who stand to gain the bottom line if we take health care costs out of their businesses. And so we believe that if you look at both sides of this equation, this group that we are asking to contribute a little more from their incomes will also get a tremendous benefit to their bottom lines in the businesses that they own and in those businesses in which they have a stock and other investments. And so they will gain in the long run in a big, big way. And most of them really understand that.
Well, Congressman, it's very hard to talk about the long run when we're in the midst of a crisis. And most of the business lobbying groups that we've heard from so far have raised concerns that this move would, in fact, increase their cost of doing business. I believe businesses with between 5 to 9 workers currently have a payroll of about $375,000 a year. Legislation, as it stands now, would hit those businesses with a penalty of about 8% of their payroll if they fail to provide health care to their workers. So this would hurt small businesses, not just big corporations. Would it not?
Well, no, it would not. 96% of small businesses are exempted from this. They don't participate at all. And the other 4% that will, in fact, participate, they will get a tremendous tax credit if they were involved in this program. And so we believe that this is a very fair program. And let me say something else. I would love to see some of the people who are making these arguments do some side-by-sides of what will happen if we don't do anything. Let's look at what has happened for the last 9 years. We've seen premiums double for the last 9 years. We think that if you look at the co-payments that people have to pay for prevention, you look at the deductibles. We have some people who recently, in order to keep their insurance, their deductibles have gone up to $6,000, $7,000, $8,000, even $10,000 a year. And so we eliminate all of that from this program, and you put a cap on out-of-pocket expenses.
Congressman, I'm so sorry, I'm going to have to cut you